Smoking and air pollution are two major culprits. When it comes to lung cancer, it's crucial to avoid smoking and limit exposure to air pollution to protect your lungs.
We see worldwide around 22 lakhs patients are diagnosed each year with lung cancer. And in India, around 1 lakh patients are diagnosed with lung cancer each year. So, if we talk about the risk factors of lung cancer, one of the most important risk factor is smoking. In Western countries, such as United States of America or Europe, around 90% of the lung cancers are caused by smoking. However, in India, only about 50% of the lung cancer patients have a history of smoking. That means around out of 100 lung cancer patients, 40 to 50 patients will not have a history of smoking in India. So smoking is the most common preventable cause of lung cancer. Smoking not only causes lung cancer, it also causes cancer of the oral cavity, cancer of the other parts of the head and neck, esophageal cancer, stomach cancer, cancer of the urinary bladder, etc. And it can also cause a condition called COPD, which is a chronic obstructive pulmonary disease, which generally it gradually impairs the lung function and patients have difficulty with breathing. In Indian context, we see that the second most important factor is air pollution. It can be indoor air, it can be outdoor air pollution, which we are all familiar with. But air pollution can be indoor air pollution also. Indoor air pollution is generally seen in households which use firewood for cooking, and with the use of LPG nowadays in rural areas also. So it is expected that indoor air pollution is gradually calm down.
If you're experiencing symptoms of lung cancer, don't delay. A regular checkup with your doctor can help identify potential issues early on. Early detection is key for successful treatment.
If we talk about lung cancer screening, there are multiple guidelines for screening of lung cancer by multiple Western medical societies. One such recommendation would be to screen individuals who have a smoking history of 30 pack years and who are in the age group of 55 to 74 years.
Lung cancer doesn't discriminate based on age. It's important to be aware of the risks and take preventative measures at any age.
Lung cancer in early stages, it may be asymptomatic. So it is always better to report any symptoms which may be harbinger of lung cancer. Some of the symptoms can be chest pain, coughing of blood, shortness of breath, severe back pain, etc. Though we have a notion that lung cancer is generally found in older individuals, it is generally not true, not entirely true. If you see in Western world, the average age of diagnosis of lung cancer is 70 years. However, in India, we see that around 60% of the patients are in the age group of 40 to 60 years. That is, the average age of diagnosis of lung cancer in India is around 20 to 30 years earlier compared to in the Western countries. It was a deadly disease around 10 to 20 years back, but it is not the same nowadays. There are many newer therapies such as immunotherapy, targeted therapies has been developed and which have given longer lifespan. And the most important thing is quality of life, better quality of life. So if one is suffering from lung cancer, so they should follow the advice that is given by the doctor.